Good morning everyone. Today I am going to give a brief introduction about cataract infection. A cataract is a clouding eye infection, its natural lenses, which lies behind the iris or a pupil. It is one of the most common causes of visual impairment, especially to older adults, and normally the lens focuses into the light clarity on the retina. But when it's become that cloudy due to the cataract, vision become blurred. So we cannot able to see as it is a natural way and then perceive vision. Although the cataract is that it's not an infection, it is sometimes leads to cause the infection or the post-surgical infection. Especially after the cataract surgeries, it is a condition called postoperative. In that cases, which is a serious inflammation inside the eye caused by the bacteria or fungi or entering the during surgery or after the surgery. In that early recognition and that proper treatment or that essential to prevent the permanent vision loss. During this, the proper sterilization and that antibiotic prophylaxis and the careful surgical techniques also helps to reduce the risk of this type of infection to our nature. So here I am come to the point. My students are presenting the case study video about this cataract surgery, how they are handled the patient and what they are seen and almost how they are recovered, that patient recovered, these things and all to clarify it to my patient. Good afternoon everyone. Good afternoon. Today we are going to see about the case study about cataract. My students are going to present the case study. Pass in that session, please are there. Okay, come on.
Good afternoon to all. I am MS Santosh. We were posted in Coimbatore Medical Hospital, where when 17th September I was posted in IVA. That I saw a patient named Mr. Ramesh, the age of 57. He was admitted with chief complaints of blurred vision and fever. He was undergone for various investigations like fundoscopy, ophthalmoscopy, visual acuity test, and tonometry. Doctor was diagnosed him as hypermension cataract. He was undergone for extracapsular extract surgery, and he was under treatment like taking medications, antibiotics, ciprofloxacin and paracetamol. He was now stable. He has no history of past medical history. Thank you.
I am going to present next.
So next we'll see what is the definition of cataract. So cataract is nothing but the cloudiness and opaque of the lens of the eyes, which will decrease the vision and will cause blurred vision. So visibly in the eyes there will be a white patchy appearance which can be seen externally, and the person who has cataract the view will be very less or the vision will be decreased, there will be no pain. So if you see in this picture, so you can see this is the eyes and this is the lens of the eyes through which the light passes and we can view. So there will be a blurry, cloudy appearance. It will be milky white in color, and here if you see this is the cross section of the eyes, and here this is the lens, and in this lens again there is like a cloudy appearance, which is why we can see that the eye is affected with cataract.
So the causes and etiology are, the most common cause is age, and the second one is congenital present by the birth, and the third one is trauma. Trauma occurs due to any injury to the eye, and the secondary is by due to any diseases like diabetic mellitus. The types of cataract are nuclear. Nuclear affects the center of the lens, and cortical that affects the edge of the lens, and the third one is congenital that presents by the birth. Thank you.
Hi everyone. I am going to explain about signs and symptoms and diagnostic evaluation of the cataract. First, we are know the signs and symptoms. Signs and symptoms are the blurred and the cloudy vision of the eye, and second one is the glare vision among the lights and the fading of colors. low vision in night times, and double vision in one eye, and frequent changes of eyeglasses perception. The diagnostic evaluation of the cataract is there are three types. One is visual acuity test, and slit lamp examination, and renal examination after pupil dilation. Thank you.
Hello guys, I'm Akash. Here I am present about treatment for cataract. That is the only treatment, cataract surgery. Cataract surgery is the only treatment to remove your cataract and restore your clear vision. During a cataract surgery, an ophthalmologist remove your clouded natural lens and replace it with the intraocular lens. Intraocular lens is an artificial lens. It is permanently stationary lens. Thank you.
So, to conclude this, cataract is one of the leading cause reversible blindness, and it is a treatment through the surgery to restore the vision to millions of people to the worldwide. However, one of the major concern after the cataract surgery, and that cataract surgery is possible to developing the postoperative infection and also the encephalitis. This is the infection through the rare can cause severe inflammation and even in the cases of permanent vision loss if that not identified and not treated also if that properly. Therefore, that maintaining the strict aseptic precautions during the surgery using the sterile instrument and providing the appropriate antibiotic coverages. So, before that and after the surgery also, that essential prevention is important in the surgery, and essential prevention also measurable to this surgery in this care. To educating the patient how they want to recover and how they want to follow the safety protocols, and then about the proper eye care after the surgery, and encouraging them to report any signs like pain, redness, blurred vision early can be helped to prevent the complication at the stage of early time in these cases. So the next, in short with that, to proper precaution is that early diagnosis and effective method to management of this stages of cases. We can ensure that cataract surgery remaining one of the most safest and most successful procedure in that modern medicines. So, I hope you will understand from that case study